I am Janelle Hani Mauricio, a third-year dentistry student. In this video, I will demonstrate how to administer a subcutaneous injection. This route is abbreviated as SC or subcut.
Before preparing or administering any vaccine, always start with the proper hand hygiene. Vaccine should be prepared in a designated area that is not adjacent to any area where potentially contaminated items are placed. Provider should prepare vaccine just prior to administration.
We must prepare the drug appropriately, ensuring that the 5 R's of drug administration are applied, which are the following:
Right drug, right dose, right patient, right route, right time.
We should always remember to greet our patients politely with a smile.
Good morning, Miss. Good morning, Mister. I am Janelle Hani and I will be your provider for today.
Afterward, we take the time to introduce ourselves to the patients. Before starting any procedure, we must double-check the patient's information, recalling their name, age, gender, and sometimes their birthday too, to ensure that we are dealing with the correct patient.
Just to ensure that I'm dealing with the right patient, may I clarify again your name is? Your age is? Obviously, you're a female. And lastly, your birth date is on? Thank you. Appropriate site for subcutaneous injection depends solely on the patient's age. For infants younger than 12 months, the recommended subcutaneous site is the fatty tissue over the enterolateral thigh. If needed, the fatty tissue over the triceps area of the upper arm can also be used. For persons 12 months of age and older, the recommended site is the fatty tissue over the triceps area of the upper arm. Begin by removing the vaccine from the storage. Next, gather the appropriate supplies including syringe and needle, cotton ball, alcohol, and bandages. Needles and syringe may be packed together or separately. Verify the vaccine you are preparing. Make sure that it matches the standing order or the provider's order. Then check the expiration date.
Never administer an expired medicine and vaccine.
With the entire site clearly visible, check for lumps, swelling, redness, warmth, bruising, or wounds near the injection site. Make sure to wear gloves throughout the procedure to ensure both safety of the patient and the provider. Next, cleanse the injection site using a cotton ball with alcohol. Wipe it in a circular motion, starting at the center and working outward.
Let it dry.
Now, hold the syringe in your dominant hand. With your non-dominant hand, pinch up some fatty tissue. With your dominant hand, hold the syringe and insert the needle into the fatty tissue at a 45-degree angle. Inject all the vaccine. Once administered, enable the safety bandage and discard the syringe and needle in a proper trash bin. Apply an adhesive bandage to the injection site if there's any bleeding. To properly dispose of the needle, carefully place it in a clear container like hard plastic bottle. This ensures safe handling and prevents injuries. For other materials used during the procedure such as gloves and bandage wrappers, dispose them in a yellow biohazard waste bin to ensure proper waste management and maintain infection control standards.
Note: I did not aspirate or pull back the plunge to check if there's blood. According to the Advisory Committee on Immunization Practices, aspiration is not necessary before administering a vaccine because no large blood vessels are present at the recommended injection sites. A 2007 study from Canada compared injection techniques with and without aspiration and found out that an injection that includes aspiration might be more painful to infants. No adverse events were reported with either injection technique. Immunization providers should be aware of the potential for syncope or fainting. Following vaccination, providers should have the patient seated or lying down when administering vaccines. They should also be aware of symptoms that precede fainting such as weakness, dizziness, and provide supportive care if symptoms occur. Providers should consider observing patients, especially adolescents, for 15 minutes after vaccination. During this observation period, patients should be seated or lying down to reduce the risk of injury associated with syncope. After the observation period, remember to thank the patient and give additional advices if necessary.
Thank you for your time and cooperation, Miss. For any unusual symptoms, you may immediately contact me.
This concludes the demonstration on subcutaneous injection. Remember to always follow safety protocols, ensure the right drug, dose, patient, route, and time, and provide proper post-injection care. Once again, this is Janelle Hani Mauricio, a third-year dentistry student. I hope you learned something. Thank you for watching!